Hi everyone. It is nice to be with all of you, even though COVID-19 has prevented us from gathering in person. My name is Alessandra Barrett, and I am a doctoral candidate in viola performance at the University of Washington in Seattle, Washington. I research music and wellness with an emphasis on injury prevention and healthy practice at home. My emerging dissertation encompasses 3 topics that together outline a theoretical framework for a cognitive and physical strength and endurance regimen for upper string instrumentalists. My first topic is the examination of practice habits, specifically how deliberate practice and self-regulation play an integral part in the quality of one's practice. My second topic revolves around music performance anxiety, looking at how holistic remedies such as mindfulness, meditation, and deep breathing can relieve debilitating symptoms of this condition. And my third topic is examining the musician as a microathlete, how training the body of the upper string instrumentalist can enhance overall fitness. In my 10 plus years as a violin viola instructor, I have heard students and parents say various statements like these. Students saying, "The violin is boring," "The violin is too hard," "My parents make me practice," "Practicing isn't fun," "30 minutes is too long to practice," "Standing up when I play makes me tired," and "I don't want to play in front of people." And parents saying, "We can't make lessons and soccer work, so we're going to have to stop the lessons for a while." "I make her use a timer when she practices," and "When will his scratchy sound go away?" Perhaps some of this jargon is familiar to you all as music educators. It is phrases like these that can potentially end a student's music education prematurely. In the current ever-progressing era, where technologies are updating rapidly, these analog string instruments don't have the appeal they once had. How can practicing be productive and also fulfilling, so that the next generation of potential music students can enjoy practicing and therefore playing their instruments? My 3 doctoral topics are linked together by what I consider to be musical cross-training. 1, understanding how self-efficacy can increase motivation in students so that they can know how to successfully engage in deliberate practice and self-regulation on their own. Understanding mindfulness and the power of cognitive training, and learning to build overall body strength through integrating micro-strengthening postures that are specifically beneficial for string players. Cross-training is a term that has been gaining considerable attention over the past several years. Typically used as an athletic term, cross-training is a progressive approach to exercising. It can add the missing link to the effectiveness of a physical workout. Cross-training can also increase power, add flexibility, build stability, and increase motivation. And the addition of a cross-training element to a workout routine can lead to endless training possibilities. I became curious how the idea of cross-training could be implemented in a musical practice setting. By strengthening the many areas of ourselves, the mental, the physical, and the musical, perhaps we could in fact fortify learning. My purpose of this presentation today is to highlight pieces of my research from 2 of my 3 topics that help support my reasoning for building a strength and endurance regimen for upper string instrumentalists. My first topic, practice habits, and my third topic, musicians are microathletes. Beginning with topic number 1, practice habits, deliberate practice and self-regulation. The importance of a structured, organized approach to practicing music is a familiar topic to music educators. Self-regulated and deliberate practice behaviors provide a framework through which to focus on the ways musicians practice their instruments. A significant amount of research into self-regulation and deliberate practice demonstrates the positive effects that these behaviors have on musical achievement. Researchers studying musical practice have found that learners begin as unsophisticated practicers and slowly acquire a broader repertoire of practice strategies over time. By preparing students for how to problem solve on their own, teachers can help students become independent musicians as a result of developing strong and effective habits of self-regulation. There is a long contested view that merely engaging in a sufficient amount of practice, regardless of the structure of that practice, leads to maximal performance. However, without extended efforts, there can be plateaus in skill acquisition. Erickson et al. Defined deliberate practice as those activities that have been found most effective in improving performance. Specific tasks are invented to overcome weaknesses, and performance is carefully monitored to provide cues for ways to improve it further. In contrast to playing, deliberate practice is a highly structured activity in which the explicit goal is to improve performance. Understanding the long-term benefits of deliberate practice is important, however, because it is not inherently enjoyable, especially for beginning students. Deliberate practice is intended to be an effortful activity that can be sustained only for a limited time each day to avoid exhaustion and to maximize gains. Deliberate practice involves activities that slice the music in different ways. Often referred to as chunking, this method breaks up a piece of music and helps focus one's attention on a single task. Useful ways to engage in deliberate practice include practicing with a tuner or a metronome to work out various kinks, Self-regulated learners must engage in cyclical activities that occur in three major phases. Forethought, methods that precede efforts to learn. Performance control, methods that occur during learning. And self-reflection, methods that occur after learning efforts. Self-regulation is described as cyclical because the feedback from prior practice and performance helps improve future practice and performance. And both the successes and struggles from previous musical endeavors are used to make adjustments during current efforts. According to Bandura, cognitive processes play a prominent role in the acquisition and retention of new behavior patterns. This is essential for beginning instrumentalists as it will dictate whether they develop positive or negative behavior patterns as it relates to practicing their instruments. Motivation is also important because it can enhance the persistence of a desired behavior. Bandura explains that self-motivation involves implementing goal setting and self-evaluating, and psychological procedures serve as a means of creating and strengthening expectations of personal efficacy. Because the strength of people's convictions and their own effectiveness is likely to affect whether they will even try to cope with the given situations, giving music students the tools to practice effectively and in a fulfilling manner at home can build self-efficacy and help motivate them to keep progressing. Self-efficacy is defined as one's perceived capabilities for learning or performing actions. Researchers have shown that self-efficacy influences learners' choices of activities, motivation, effort expended, persistence, achievement, and self-regulation. Self-efficacy can help music students develop skills to deliberately practice and self-regulate their time. Maintaining effective and enjoyable learning during private practice is an important part of playing an instrument. because simply telling students to practice is not sufficient enough to foster the motivational resources they will need if they are to make significant progress. In the areas of quality of practice, novice versus advanced students, structured versus unstructured practice, and blocked versus alternated practice, many studies illustrate how deliberate practice and self-regulation contribute to more productive learning. Regarding quality of practice, Kim, 2006, found that the implementation of practice diaries helps students plan out their practice sessions by setting proximal goals and applying appropriate practice strategies, while similarly, Mixa, 2008, established that students who engaged in informal creative activities, in addition to more structured technical work, tended to be more cognitively engaged while they practice. Regarding novice versus advanced students, Nielsen, 1990, found that advanced Oregon students know how to better utilize learning strategies to select and organize information and then integrate it with existing knowledge. While Drake and Palmer, 2000, found that with increased skill level came gradual improvements in performance tempo and pitch accuracy. Regarding structured versus unstructured practice, Bio, 2004, and Cantwell and Miller, 1994, established that deep structured learning involves the ability to problem solve and to have more flexibility while practicing. Surface unstructured learning tended to be more rigid and provided for more difficulty in resolving problems. Regarding blocked versus alternated practice, Logan and Balota, 2008, as well as Carter and Grand, 2016, examined the effects of spaced out practicing. They found that alternated or spaced out practicing showed better retention of music. In 2019, I piloted a small study that examined the role of two different time practice conditions and their effects on performance outcomes of pitch and rhythm in a group of violin viola students after 2 weeks spent learning a new piece of music. I was interested in how students would implement deliberate practice and self-regulation on their own. 6 private violin and viola students were divided into 2 groups, Group A and Group B. Each group was comprised of 1 beginning student under the age of 18, 1 intermediate student under the age of 18, and 1 beginning student over the age of 18. Students in Group A were instructed to practice the piece 1 time a day for 30 minutes, 5 days a week, while students in Group B were instructed to practice the piece 3 times a day for 10 minutes each, 5 days a week. And student performance tests at the end of the 2 weeks were anonymously evaluated by me, Observer 1, and an independent peer reviewer, Observer 2. The results indicated a higher performance mean score for students in the 10-minute 3 times a day group than for students in the 30-minute 1 time a day group. The blue columns represent beginning students under the age of 18, the orange columns represent the intermediate students under the age of 18, and the purple columns represent the adult students. After interviewing the students in each group, findings indicated that students in Group B thought that each 10-minute segment went by fast and that they had to get as much work done as possible in that time frame, while students in Group A found the 130-minute segment to be long and tedious. It was evident that the students in Group B figured out how to deliberately practice and self-regulate their time better than the students in Group A. Before going on to my third topic, it is important to reiterate that developing skills in deliberate practice and self-regulation is important for athletes of any kind. Implementing deliberate practice and self-regulation can help focus on the quality of one's training. And isolating issues and applying effective problem-solving strategies is key to making progress in any field. Topic number 3, musicians or microathletes. The body of the upper string instrumentalist. A microathlete is a musician. In juxtaposition to the microathlete, a macroathlete is a sports athlete. I call sports athletes macroathletes because they train their bodies and their minds to work small and large muscle groups and are typically in full body constant motion. Musicians are microathletes because they train their bodies and their minds to work small and large muscle groups, but are not typically in full body constant motion. Microathletes and macroathletes have the following in common. They practice or perform almost every day. They share activation of many of the same muscle groups. They engage in the same contractions. They sustain musculoskeletal injuries. They play through pain. They compete in challenging environments. They experience high levels of anxiety. And they face a little off-season because the training really never ends. Upper string instrumentalists are a group of musicians who particularly engage in such microathleticism. While violinists and violists primarily utilize small motor movements to play their instruments, there are large muscle groups also involved that aid in healthy ergonomic playing. By implementing a micro-strengthening regimen that focuses on body alignment, strength, and relaxation, the microathlete can train the muscles that they both use and overwork. The physical demands of music performance are such that musicians have been compared with sports athletes many times. Playing a musical instrument is a demanding activity that involves a complex series of physical actions and repetitive movements that should demonstrate a well-balanced combination of cognitive, expressive, and physiological excellence. But researchers and health professionals who work with musicians have posited that the physical condition of many music students and professionals may be inadequate to cope with the demands of playing their instruments. The violin and the viola are two instruments that are especially ergonomically challenging for the body and require instrumentalists to play with rapid, complicated, and repetitive motions with small muscles like those of the hand, while they must engage in rapid, complicated, and repetitive motions with large muscles like that of their arm and shoulder. And in addition to the areas of the body that are responsible for repetitive movement, there are also large muscles which stabilize the instrument and the musician themselves, like those of the trunk. The musculoskeletal system is a very complex and capable entity that enables the upper string instrumentalists to play fast, repetitive movements using small and large muscle groups while allowing the body to carry a static load. Music making is a physical activity that depends on muscle movements that line up the various body segments into their appropriate positions and then move them out of their appropriate positions in ways necessary to produce sound. Playing the violin or viola requires a significant degree of muscular strength, coordination, and endurance to maintain the fixed postures needed to perform. And at the same time, asymmetric postures are unavoidable for upper string instrumentalists, forcing muscles to be used, overworked, and underconditioned. The following is a brief description of the musculature of the microathlete's body. Beginning with the trunk consists of deep spinal muscles, deep neck muscles, intermediate back and neck muscles, anterior and lateral neck muscles, thorax muscles, posterior muscles of the trunk, abdominal muscles, pelvic muscles, and hip muscles. The shoulder consists of scapulothoracic rotator cuff muscles, deep scapulohumeral muscles of the shoulder joint, and scapulohumeral muscles of the shoulder itself. The elbow, because we bend and extend a lot, involves muscles for flexion and extension of the elbow. The wrist and hand consist of flexors and extensors of the wrist, extrinsic flexors and extensors of the fingers, intrinsic muscles that move the fingers, intrinsic muscles of the fifth finger, and extrinsic and intrinsic muscles of the thumb. And lastly, the knee, because the upper string instrumentalists should never lock their knees, consists of 3 muscles that aid in bending and straightening the knee. There are 3 primary contractions that microathletes and macroathletes engage in. The first are called eccentric contractions. This is when a muscle opposes a movement and applies the brakes, resulting in lengthening of the muscle. Concentric contractions are when a movement takes place because of an active muscle, resulting in the muscle insertion being moved closer together. And isometric contractions are when a position is fixed by a muscular contraction, resulting in muscle insertions that do not move at all. Sports athletes engage in eccentric and concentric contractions whenever they extend their arms and legs, like in soccer, basketball, football, swimming, etc., and engage in isometric contractions whenever they have resistance on a muscle, and maintain a fixed position, like baseball, gymnastics, martial arts, etc. Upper string instrumentalists engage in eccentric and concentric contractions whenever they extend their fingers when creating notes, or extend their elbow when taking a down bow or an up bow. And they engage in isometric contractions with their left arm to support the load of the instrument, as well as with larger stabilizer muscles which surround the shoulder joint and trunk to support the weight of the musician. When compared to isometric and concentric contractions, eccentric contractions cause significantly greater magnitudes of damage. Because fewer motor units are recruited during eccentric contractions, greater mechanical stress is applied to the active muscle fibers, resulting in the sensation of pain and even the possibility of damage to the muscle. Delayed onset muscle soreness predominantly occur following activities that emphasize eccentric contractions. Lima and Donati explain that eccentric exercise-induced muscle damage is a multifactorial phenomenon that occurs when skeletal muscle is exposed to elevated mechanical stress conferred by unaccustomed eccentric exercise. This exposure to stress leads to cellular disruption, loss of function, soreness, and leakage of intracellular proteins to the bloodstream. This is exactly why micro and macro athletes need to warm up before they engage in eccentric, concentric, and isometric contractions. Cold tissues are slow and more prone to injury. Once heated, blood flow is increased and tension is reduced. Muscle fatigue and injured tissue also contribute to increased muscle tension. This is because muscle use 2 types of fuel. Fuel stored in the muscle itself and allows the athlete to use it immediately, and fuel that is not ready to be used and must be refined in the muscle itself before utilizing it. As a result, playing with intensity before being sufficiently warmed up will exhaust all of the immediately available reserves, and this will undoubtedly diminish one's performance and make it more likely for injuries to occur. The combination of highly repetitive movements, long hours of practice, poor physical conditioning, and awkward postures is suggested to cause the high number of performance-related musculoskeletal disorders, PRMDs, suffered by musicians. Musicians are not only susceptible to developing musculoskeletal disorders, but they suffer frequently and over long periods of time. These disorders are often painful, persistent, and can be occupationally disruptive. Muscles that contract frequently or forcibly for long periods of time do not have a chance to rest and replenish the chemicals needed for further contraction. Poor strength and stability in proximal near areas can cause overuse injuries at both proximal and distal further sites. This can occur as a result of faulty ergonomics and inadequate postural support, leading to increased stress all over the body. Chronic pain can also cause long-term changes in the circuitry of the spinal cord, which may result in sensations that were previously innocuous to become painful. What separates micro and macro athletes are, unlike sports athletes, musicians often assume that their painful condition is normal and find ways to mask the effects of an injury. Unlike sports athletes, musicians face a culture of silence. Unlike sports athletes, musicians have unaddressed injuries present by the time they enter college. Unlike sports athletes, musicians focus primarily on the quality of sound and intonation versus musculoskeletal disorder education. And unlike sports athletes, musicians don't continue to receive musical instruction at a professional level. According to Renzing et al. 2018, performance-related musculoskeletal disorders affect approximately 70% of instrumental musicians, with string players having the highest risk at rates of 65 to 88%. Violinists and violists are thought of as being the most damaged group of musicians. The neck, jaw, shoulder, hands, and back are the most commonly affected regions of the body in the upper string instrumentalist. In ergonomic terms, holding the violin or viola under the chin or jaw can disturb the symmetry of the head and shoulders, leading to issues in the surrounding areas. Many of the problems that violinists and violists face can be categorized based on extrinsic or intrinsic factors. A musician's size, strength, flexibility, and the presence of underlying disease are intrinsic risk factors for PRMDs. A musician's performance technique and playing environment account for extrinsic factors. And lastly, violists experience more pain in their shoulder and arms than do violinists because of the greater weight and size of the viola compared to the violin. In the current and future eras of music education, teachers should impart knowledge from the very beginning of instruction regarding proper music technique as well as mind-body health in order to handle the demands of playing their instruments. The micro-athlete training method is an emerging pedagogy inspired by research in the areas of deliberate practice and self-regulation, mindfulness training, and the body of the upper string instrumentalist. This pedagogy introduces the idea of cross-training into and out of the practice room to enhance productivity and motivation, and encourages deliberate practice activities both on and off the instrument. And by implementing micro-strengthening exercises specifically designed for the upper string instrumentalists, violinists and violists can safely build overall body strength in an effective manner. Thank you. Here are my references. I'll move this so you can see them. I think everyone will have this video. So that's the first page, second page, page. Thank you, everyone.